and welcome to another episode of iMed, where we bring you the latest developments in the field of medicine. And today also the focus is on the global pandemic that has plagued and engulfed the entire world. The death toll is rising, the casualties are rising. But we have treatments that are available, vaccines that are available. So to talk about the new normal, today with us we have Dr. Sunil Ratnapriya, the Secretary of the Association of Private Hospitals and Nursing Homes. A very good evening to you, Doctor. Welcome to the show.
Good evening to you. Yeah.
So Doctor, to start off the discussion, initially let's focus on what has happened globally. Where exactly are we right now in a global context?
Well, in a global context, the disease, we have come to a situation where the disease is still continuing, but we are also managing to develop instruments that could stand up to this challenge. The situation continues to be same in the countries like United States, India and Brazil. Situation in UK is also not so good, but in some countries like in Europe, situation has somewhat stabilized. So vaccine production has come. People have got used to the precautionary preventive measures. So we are gradually learning to live with the pandemic.
Right, Doctor. So from a global context, let's come to Sri Lanka. In a local context, how is the situation being managed right now with the efforts of the government and as well as with the efforts of the private healthcare sector? How are we managing the virus right now?
Well, the government program has been fairly extensive and effective. The mechanisms for quarantine, detection of cases, isolation of cases and managing cases are in force, and also the vaccine program has started, which is a very good development. So similarly, private sector is also, along with the government, gradually getting into the battle.
Right, Doctor. Now, Doctor, you represent the Association of Private Hospitals and Nursing Homes. Let us give us basic introduction as to what this organization is and what it does, the services it provides.
Yeah. Now, basically the Sri Lankan health sector comprises of the dominant government sector and the private sector. So it is the Association of Private Hospitals and Nursing Homes, the only organization that is there on behalf of the sector to represent the private hospitals and nursing homes. Now, when you say private sector, it's not only hospitals and nursing homes, but you get individual practitioners, general practitioners, the pharmaceutical sector, and so on and so forth. But our association basically, from the industry point of view, represent the hospitals, their needs, their issues, and their concerns.
Right, Doctor. With regard to COVID-19, what are the safety protocols and health guidelines that are currently in practice in these private institutions?
From the beginning, what we call the first wave, we were preparing our hospitals. We started taking all proposed action proposed by the government, such as commencement of a COVID preparation committee, and then on various fields, on the question of patients, treatment of patients, looking after our staff, preparing the institutions. So many protocols have come into place. So directed by this COVID preparation committee, whatever the government protocols that has been adopted, that has been sent to us, we have adopted. For example, like screening of patients, then introducing personal protective equipment, then detection and distribution of positive cases, positive PCR positive cases. So each and every aspect is being guided by a protocol. So most of those protocols we have been following, the private hospitals have been following those protocols.
Right, doctor. Since you mentioned detection, let us talk a bit about the detection of the virus and the steps that you can take afterwards.
Yeah.
Now, that is the option of doing a PCR or an antigen test available at private healthcare institutes as well right now?
It's like this. We can say the PCR test is available. PCR facilities are available in few recognized, few identified hospitals where the government has given the approval to do so. There are other hospitals which are also being considered and processed, the applications are being processed. So anyone who consider themselves who have been exposed, or a doctor has seen somebody and requested PCR test to be done, a patient can go and request one of these hospitals a PCR to be done. The issue of antigen test is different when it comes to the private sector. We are not supposed to do it as on request. Antigen test is only being done in very, very specific situations as given in the government protocol. So that's how the situation is. But PCR testing you can do, and that is the gold test also for the detection of COVID.
Right, doctor, and I think that's a very important clarification as well, because we see some people actually use these two words interchangeably as well. They think PCR test, antigen test, they're both the same, we can just get one test done. But like you mentioned, there is a distinction when it comes to these tests, and as well as how you can get these tests done.
Yes.
But doctor, we see that most people are reluctant or they hesitate to go and get a test done even if they feel like they have symptoms. I think this is mainly because there's some stigma surrounding the disease, that people think even if you are tested positive, even if you get the treatments, that you can always contract the virus from this particular person, and there's a lot of fear surrounding this idea. So how has the health sector looked into this?
Now this education is also always being done, like in discussions like this, or even in medical institutions. This aspect is being discussed, and people explain. Newspaper media, social media, everybody's. But in spite of that, I agree with you that there is a certain fear, confusion, stigma, and things like that, which is also one reason why the disease is continuing. Because if we have a fairly scientific approach, if we are clear as to what should be done, it will help us to control the epidemic. So if you suspect that you have been exposed to a COVID positive person, you can always, you need not think yourself that I should go and do a test. You can always consult a doctor, medical officer. This is what is being told, either in the government or the private sector. So they will advise you. So and if you are positive, there is nothing to worry, I mean, in the sense other than that you have got the disease. There are facilities. Now the health system is geared and doctors know what to do. So of course you will be sent for a quarantine if you are found positive. So the new development that has come is that the private sector has been, with the government approval, is now able to offer facilities at intermediate care level. When the disease is not progressed very much, at intermediate level, the person can be kept at an intermediate care facility organized by one of the private hospitals.
Right, doctor. If we could elaborate a bit more on these intermediate care facilities that are available,
Yeah.
What is the duration that a positively identified patient should stay at one of these facilities, and what is the way for them to get contacted towards this procedure?
Right. Positive, from the time you are detected as positive, you will be admitted to one of these facilities and will be kept for 10 days. So generally, positiveness is considered from the day the PCR has become positive. You can have symptoms earlier, but you are considered positive confirmed from the day you have PCR positive, and you will be basically kept for 10 days. So what if you face such a situation? What you should do is, all these hospitals who have this facility have appointed somebody called coordinator. So their details are given, and from the hospital also you can get. So what you have to do is, you have to indicate to this coordinator that your PCR has become positive and that you intend to come to one of these hospitals. Then the coordinator will inform the government unit that coordinates this, and also at the same time they will also inform the PHIs. So it is the government unit that coordinates this admission, because it is something like a central admission. So they will facilitate you to go to this intermediate facility run by us.
Right, doctor. Now, since we are on the topic of detection and treatment, how important is an early detection of COVID-19 virus? Because we see, if you look at the fatality rate, it's not very high, especially in Sri Lanka. So is there a need to fear this virus? And also, how important is early detection to combat this virus?
Well, early detection is very, very crucial, because one thing is that disease is not fatal, but in certain people it can lead to complications. So this is exactly what we should be concerned with. Disease is a viral disease. So that is one aspect. Second aspect is to protect the people who are around. So therefore, if you suspect, it is always good to approach a medical officer, and if the medical officer recommends you a PCR, for you to do a PCR and inform wherever you have to inform, so that they will direct you to the correct facility. It will be a quarantine facility, it will be a treatment facility, and so if the disease takes the normal course of events, it will, like a normal viral fever, it will be over. We know that there are so many people who have recovered. So why you fear? Why concern? So therefore, I think people should really come out if they have a concern, that they should use the facilities that are available, get themselves detected, and go into these facilities. On the other hand, assume that your condition can deteriorate. Well, again, then you are in a medical facility, and then the doctors can look after you. They can use the facilities. The government has the facilities to treat people beyond the intermediate level. So even if a patient who is in one of our units, their condition deteriorates, we will inform the government units, Ministry of Health, and they will take you to a necessary facility and look after you.
Right. Like doctor said, this is a kind reminder to all our viewers. If you think that you have symptoms, or if you see any symptoms in one of your family members, just know that there are services available to you, provided by the government as well as the private healthcare facilities. Like doctor said, early detection is key to combat this virus as well. And doctor, talking about detection and treatment, we've seen that most fatalities were occurred in patients who had other non-communicable diseases like diabetes and cholesterol as well. So that we can enlighten our viewers, are there any diseases that are considered as, like, if you contract corona, if you have these particular diseases, that your condition can get quite serious?
The evidence has shown that in old age, and in like immunocompromised patients, those with long-term diseases like kidney diseases, as you mentioned, diabetes is one of the main comorbidities, other cardiac conditions that the disease can deteriorate, condition can deteriorate. So it is very important that those diseases are also kept under control. In the current situation, that you look after, if you have such comorbidities, if you have such long-term diseases, that you take additional precautions to. In fact, this was one thing that we always highlighted. We reminded patients who were frightened of coming to hospitals that there is corona inside the hospital all over the place, that we took that fear off. We created digital platforms. We created, visiting their homes and offering treatment, and facilitated all these non-COVID patients who who are having long-term illnesses to look after their conditions so that they don't deteriorate, and at the same time take additional precautions, particularly for this risk category, for them not to contract COVID. So in that sense, the early detection is very important. That is, if you have a member in your family who is hale and hearty, but then there may be additional members in the family who are with such comorbidities. So if you are detected positive, you can safely go into a facility and safeguard your other members in the family from those risks.
Right. Just like doctor said, sometimes we think it's safer not to go and get tested. We think there's a huge risk in visiting a hospital or a treatment center. But like doctor said, they've taken all the precautions as necessary in order to combat the virus and to make the entire procedure as safe as possible. And like doctor said, you might think that you are safe from the virus, but your family members might be at risk, because you can simply be a carrier and not be affected by it, but your family members can always be at risk. So that's why it's so important to get an early detection of the virus if you do have any symptoms. Now, doctor, we've spoken about the detection, the treatment centers. Now this brings me into this new variant that has broken out, that has come to Sri Lanka as well. And if I'm not mistaken, this virus, the first person in Sri Lanka that was detected was Moeen Ali, the English cricketer who came with the UK variant.
Yes.
Let's talk a bit about this new variant. Can this be diagnosed through a normal PCR? What's the difference with this new variant?
It may not be. The PCR test will have to be oriented towards that detection. So it will be the molecular biologists who will be really able to speak on this. I may not be able to speak on this, but the PCR test has to be adjusted to detect the variants.
Right, doctor. And now we see a lot of discourse and discussions on being safe, taking care of yourself, wearing masks, using sanitizer. All these guidelines are given, this advice is given, but still we see some people, they don't really take these things very seriously. So what is your advice that can be given, apart from the normal safety health lines that have been set? What else can we do in order to protect ourselves? What are the other measures that we could take?
I think many people, what happens is that they gradually get relaxed, and also they may not be still knowing the reasons behind the wearing of personal protective equipment, the mask and so on. Because we should go back to the basics. We know that it spreads, it's a respiratory disease illness in the respiratory system. One way of it spreading is the virus itself. can within a distance of a meter cross and get into your respiratory tract. The other thing is that if you touch a person with the virus on, then that can go into your body through your eyes, through your mouth, through your nose. Another way is if it is on a surface, we touch it, and then we touch our nose or mouth or eye, it can get in. So actually the personal protective methods are devised to cut these channels. So I think we need to remind this all the time, that always if there is a diseased person near you, it can sort of hop across to you. So this is why we need to be away from a person. Then also why you wear a mask, because even if you come across, if you get across, then that mask acts like a barrier so that it doesn't get into you. Why do we do hand washing? Because naturally we touch surfaces, and naturally we touch our eye and nose. So therefore, to prevent it from getting into those, we keep our hands always clean and wash the hands in a proper way. So so this message has to be always talked about. Now what happens is, now we know this very well, but look at when we go into a function, look at the functions that are happening through the when we see it in social media or TV, we gradually the mask is removed, and we try to go back to the earlier situation.
Yes, that's very true, doctor. And as they say, we always, we only keep something in our minds for around 2 weeks, then we forget everything. And that is why it's so important to go back to the basics. Like doctor said, it's so important to use sanitizer at all times, use protective gear, and that is the way to combat this disease. And also, doctor, I wanted to touch a bit on this vaccine as well. Now the government has started administering the vaccine. If you get the vaccine, does that mean you are completely immune to the disease, or do you still have to follow this?
Certainly not. It is an additional assistance or a support that is being given to combat the disease. And repeatedly the health personnel and experts are emphasizing this fact, because all these vaccines, they provoke an immune response in the body. It is not like a treatment. It provokes the immune response and build up your immunity. And then this immune response, this building of this immunity, there is a percentage. It is not 100%. So therefore, always you have to have additional methods to cover that that percentage which is not being protected by the vaccine. So vaccine certainly strengthens you, improve your immune response, but additional measures has to be taken. And also now we are with the first dose. The first dose is being given. So we don't know how effective the immune response will be for the first dose, and how soon it will come into the body. So it is with the second dose that the immunity will really come to stay with the body. So therefore, we need not relax at all like we relaxed after the first wave. So while being happy and while being morally strengthened that we have got this vaccine, additional support, we have to keep the guard on.
Right, doctor. Like doctors said, it's so important to conform to the safety and health guidelines that have been set by the government. It doesn't matter whether you've got yourself vaccinated or not. Like doctor said, it's truly important that we do stick to the basics in order to combat this virus as a nation. So thank you very much, doctor, for imparting your knowledge on our viewers and for enlightening us on the importance of an early detection, and also you enlightened everyone on the treatment centers that are available, the intermediate care centers that are available, provided to you through the private health sector as well. So we touched upon different areas, but ultimately what everyone should keep in their mind is to follow and conform into these health and safety guidelines that will definitely keep you safe. So thank you very much once again, Dr. Sunil Ratnapriya, representing the private hospitals and Nursing Homes Association. Thank you very much, Doctor. So on an ending note, we wish that all of you will definitely, we wish and hope that all of you will stay safe and conform to the health and safety guidelines that have been set. That's it from iMed today. Good night.